Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. So glad that you could join us today. In studio today, we're talking with Topher Wurtz. He's returning with us to speak a little bit about Autism Village and the Autism Village App that he's developed that is soon to be launched. It is estimated that 1 in 42 boys will be born autistic. And Topher, as an autism dad, is here to talk to us today about autism and how he's helping and how you can help as well. How are you doing today, Topher?
Doing great, thank you.
As an autism dad, you said another segment when you were here before that you're the father of a couple of boys, the younger of which has been diagnosed with autism. Could you talk a little bit about what autism is and what prompted you to seek a diagnosis? You didn't just wake up one day and say, I think I'll go have my son tested for autism. There were some things that led up to that.
Yeah, that's right. Our son Kirby was diagnosed just under 2 years old. We had two boys very close together, 11 months apart, and I was traveling a lot for my work at the time, and so we had a young lady from New Zealand staying with us who was helping my wife with the boys. And she'd been a preschool teacher in New Zealand. She identified some behaviors that Kirby was having that were consistent with behaviors that she had seen with some of the kids in her preschool back home that were autistic. And so she brought it to our attention, and we were able to reach out to the Easter Seals organization and have Kirby evaluated. And at that time, the evaluator informed us that he did appear to be presenting with symptoms of autism.
Mm-hmm. Now, many folks aren't as fortunate to have someone knowledgeable about early childhood development as you and your wife and family were. In your experience as an autism dad and someone who's applying your knowledge to this disease to help others, have you noticed that there's maybe some resistance if someone, say a teacher, comes to a parent and says, hey, I think maybe this might be going on with your child? Is there a denial that takes place early on?
I think it's a difficult diagnosis for any parent to work with. And so in many cases, including our own, the first reaction was, really, are you sure? But I think it's important to be open-minded because the most difference and the most help you can give folks that are diagnosed on the spectrum is from whatever that early age is until they're in their sort of mid-20s when we all kind of become who we're going to be. Mm-hmm. And so it's important, I think, to be open-minded. I tell other parents who are in the very early days of diagnosis to be open-minded about the diagnosis, that an overdiagnosis isn't something to be afraid of, but an underdiagnosis means you're losing precious time. There are certain behaviors that are common, and so are ones to look out for. Children that aren't making eye contact, children that aren't pointing at things, children that have certain obsessions or compulsions to line things up by size, shape, or color, these sorts of things. So it's not always consistent, but usually there's some combination of sort of behaviors present which an experienced evaluator can identify as likely meaning that you may be dealing with some level of autism.
Are these symptoms of autism that your friend from New Zealand recognized, are these things generalized? I guess my question is, how often in your experience have you seen a misdiagnosis? Say someone is autistic, but they've been diagnosed with ADHD or some other form of disorder.
Yeah, I guess I don't have a lot of experience to give specific sort of statistical or empirical evidence on that, but I think at the higher functioning end of the spectrum, where kids are maybe just a little quirky or a little less social, then it's more likely that they go undiagnosed because they're going to get by okay. And in many cases, they have they may have very specific skills academically that make them very successful in one area or another as well. So not always, but sometimes. And so as a result, I think the higher functioning kids are less likely to get diagnosed, and we certainly have met a number of autistic adults who were never diagnosed or believe they're autistic but were never diagnosed. As far as a misdiagnosis for ADD or ADHD, I don't know how often that happens, but it wouldn't surprise me that it happens, occasionally.
So basically what we're saying is that there are, as you say, in the higher functioning spectrum of autistic people who become autistic adults, they're conducting their daily lives, they're working in healthcare, they're driving cabs, they're buying gas, they're running businesses, they're doing what we would call the normal things in society. What should why should they care about autism? I mean, if they've hired someone who finds out that they're autistic later in life, but they've been doing a bang-up job for the last 5 years, why should they care?
Well, they shouldn't probably. I mean, the neat thing about it is that we're starting to see a number of employers come out and recognize that autistic adults make fabulous employees in certain roles better than the average person. So, in many cases, autism can, on the higher functioning end of the scale, certainly can be a benefit. On the other hand, the reason that businesses need to be aware of this is that even for those folks that are high functioning autistic adults, they may have sensory issues that challenge them, and so putting them in a big open plan office with lots of noise and buzzing fluorescent lights or something could make it impossible for them to be successful. Whereas if you gave them a quiet place to work with incandescent lights, they might be the most amazing statistician or something that you have on your team. So realistically, I think, especially in retail businesses and places where the general public congregates, it's important for the business owners as well as the people that are facing off directly to understand a little bit about autism and the things that autistic people and autistic adults may be dealing with in the course of their daily lives.
Now, that was on the professional end, but when it comes to the consumer end, how can businesses be more in tune with the autistic who may not be on the higher functioning end of the spectrum?
Well, I think that's particularly acute, sort of maybe for families that are moving around with autistic kids. And so, as a very simple example, seating an autistic person in a restaurant in a noisy area in a booth where there's somebody right behind them and so forth is probably less likely to be successful than finding them a quiet table away from the noise. In the case of autistic adults, there may be issues with food, certain kinds of food or food allergies or certain environmental things. Many autistic, sort of high functioning and moderately functioning autistics describe auditory processing challenges where loud environments with multiple conversations, we can single out a conversation, you and I, in the midst of a crowded room. To the autistic person, all of those conversations are coming in at the same level, along with, a buzzing lamp and a fire truck going by and so on and so forth. So when businesses understand these things, they can adapt. I believe they can adapt their physical plan when a person who's working with somebody can identify that they may be autistic and then adjust their approach to be more friendly towards the kind of interaction that somebody who has autism may need. Then as a result, those businesses are going to get more patronage from this population. It's a tight group. They talk a lot. Certainly the app that we're building will facilitate even more of that kind of conversation. And this is a large group now. This is 3 million U.S. families and growing at, as you said, 1 in 42 male births, 1 in 68 births overall. So this has been accelerating for the last 20 years. So this is a large portion of the population that businesses, everything from museums or attractions to restaurants to retail establishments, are all they're going to be serving them regularly. So it's important.
Now, this app that you've developed, the Autism Village App, and when you're talking about businesses changing the way that they do business, not only for the handicapped by providing spaces out front, ramps and rails and whatnot, when you're talking about something as massive as accommodating one autistic child that comes to a restaurant who needs to be seated in a certain way, how can your app help the families to find a place that has done the homework and has taken the care to accommodate people with autism?
Well, so there's 3 ways that the service will help. That Autism Village can help families that are searching for autism-friendly locations. The first is that they can view ratings and reviews by other autism families or autistic adults that explain in their own words what's worked or what hasn't worked at those locations. And not every location will always be perfect. There may be a sort of a restaurant setting that's always going to be loud, but maybe they have the dietary thing because they have a lot of specialized selections for food allergies and so forth. So somebody that doesn't have sensory issues can get their food things met there, whereas if you're a sensory person, you might want to find a quieter restaurant. Okay. So you'll be able to do that based on reviewing the ratings and reviews of the population. The other two ways are that we're working on a very simple online training for businesses and client-facing staff to help them understand autism and how they can adapt their approaches a little bit to be more friendly towards the autism population. And we'll display a small badge on the business profile if the business has gone through that, or on a person's profile if that person has gone through that training. Mm-hmm. And finally, around the country and around the world, there are consulting organizations that do much deeper training, consult with businesses about how to change operating procedures, how to change physical plan, how to really change their approach in a much more significant way to accommodate this population. And we'll support all those organizations on the platform so that if a business has been trained or has gone through their certification programs, you can see that on the business's profile as well. So the ratings and reviews from the population, the basic online training that we offer, and then the deeper trainings and certifications that other organizations offer will all be available on the platform and will help.
Now, wrapping up, I'd like to ask you to let our listeners know where they can learn more about Autism Village and where they can learn more about downloading the app when it becomes available in other places than just your website.
Yeah, so everything will be announced, and the best way to stay in touch is right on our website. It's autismvillage.com. And then once the app is available, it will be available in both the iTunes Store for iPhones and iPads, and in the Google Play Store for Android phones and Android tablets.
Great, great. You've been listening to Health Professional Radio. I'm your host, Neil Howard. It's been an absolute pleasure to speak with Topher Wurtz today, returning with us to talk more about Autism Village and the new app that's been developed and will soon be available for download through the iPhone App Store or through Google Play, as well as at www.autismvillage.com. We've been here talking about the app and some of the challenges that people with autism face on a day-to-day basis. And we've also been talking about how businesses can change the way that they do business in order to accommodate the autistic, thereby performing a great service and having a bigger client or customer base as well. It's been great having you here with us today, Topher.
Thank you very much.
Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to our podcast on iTunes.